Alright, my name is Miriam, and today we're going to be going over some proper wheelchair use, measurements, and then some side effects of an improperly fitted wheelchair. So first we're going to be looking at the seat depth. So before I sit down, I'm going to lock the wheelchair. That's important. Okay. Sitting down, the depth is going to be measured from 2 to 3 fingers in between the seat chair and the back of your popliteal area. If this seat width is, or seat depth is too short, this is going to increase pressure on the ischial tuberosity and also some lack of support and stability. And if it's too deep, then there's going to be too much pressure on the popliteal fossa, and also it will disrupt circulation. Next is seat width. So the width of the hand should fit in between the greater trochanter and the sides of the wheelchair. And if your hand does not fit through there, then it is too tight. So if it is too wide, then you'll have bad posture and it will be difficult to maneuver. And if it's too narrow, then you're going to have pressure on those greater trochanters, and then it's going to also be hard to shift your weight. So next we have back height, which should be 4 fingers between the top of the chair and your armpit, also known as your axilla. So if the back of the chair is too tall, you're going to have some rubbing and irritation on your scapula, and also it's going to decrease your mobility. And if it's too short, you're going to decrease your trunk stability and support as well. So next is the armrest height. So when your arms are on the armrest, your shoulders should be level. If they are too tall, if the armrests are too high, then it's going to be hard to propel yourself out of the chair, and to stand in this position is just uncomfy. If it is too low, then your trunk is going to lean forward, and it's also going to be difficult to stand from sitting in the wheelchair. Next is the lower leg height. So you're going to measure from the heel to the popliteal fold, and then you're going to add 2 inches as well. So my heel to the popliteal fold, which is the back of my knee, which is about 18 inches, and then adding 2 inches, that would be 20. If it is too low, then you're going to have pressure on your thighs and also your ischial tuberosities, your sit bones, and then if it is too high, that would just be uncomfortable. And then the foot plate height, this is the foot plate, you want it to be 2 inches off the ground. I'll measure here. Two inches off the ground, and if it is too low, then it's going to hit the floor. It is going to increase pressure on your thigh, and it will also lower your center of gravity. If the plate height is too high, then you'll have pressure on the ischial tuberosities. It'll decrease trunk stability, and it will be hard to sit at a table. You won't be able to get your knees underneath that table. And then also, just some basic vocab of a wheelchair. You have your push rins. Push rins are on the side of your rear wheels, and they are going to help propel the wheelchair, and also with steering, depending on how much force you're applying to each side. And then caster wheels are your little wheels in front here, and then these help steer as well. You do not propel with the caster wheels. And then finally, wheel locks. They're found that are going to dislodge the rear wheel access. So you want to use these anytime you're going to be sitting or standing a patient, just for safety. And to remove one armrest, an instance that you would need to remove one of the armrests would be if you're going to transfer your patient in a squat pivot transfer from the wheelchair to the bed, or from the bed to the wheelchair. Okay, this is how you would properly remove an armrest from a wheelchair. Some wheelchairs are different than others. Most times you have to push and pull up extremely hard, or sometimes the whole armrest will rotate backwards. And then removing the lower leg rests like so. This would be used if you're going to have your patient perform a sit-to-stand so that they do not trip over those wheelchairs. You would do it like so. This one doesn't latch either. Okay, there we go. And the other side as well. And you want the foot pedals to be facing inward, and same with the leg rests, so that your patient can utilize those best. So, in conclusion, it's vital for PTAs to know the proper components of a wheelchair so that we can best educate our patients. An improper fitted wheelchair can lead to increased pain and decrease their safety. For the patients being properly fitted with unique measurements, it's essential for independence and